Hello and welcome. My name is Joe Macbeth and I'm the President and Chief Executive Officer at the National Alliance for Direct Support Professionals. Thanks for joining me today on this special COVID-19 pandemic webinar, Practical Applications for Hiring, Engaging, and Keeping Direct Support Professionals During and After the Pandemic. And I know that times are difficult and challenging, and DSPs are stressed and working very hard for the past 3 or 4 months. And we also know that there's a lot of people, once the unemployment benefits start to dry up, a lot of people are going to be looking for jobs due to the downturn in the economy. And as we look at things at the NADSP, this is what we call a very ugly gift. We wish that we never had to deal with these situations, but as John Milton wrote in the 1600s about a silver lining, I think if there is a silver lining, there may be some really good people out there who are going to be coming looking for direct support professional jobs. I think our trick and our duty is to try to keep them when they come and enter this work world, many of whom may know nothing about direct support. And then, like many of us who are listening today, who started our careers as direct support professionals, we didn't either. And something appealed to us, something brought us in. And I think that is what we need to appeal and really try to bring this new cadre of potential direct support professionals into our field. That's me, Joe Macbeth. We have never seen such a drastic and sudden change in our service system. One day, direct support professionals are out doing their work in our communities. I often say the direct support professionals office is the community. That's where they work, and that's where we support people in their homes, in their jobs, in the places that they play and recreate in. And the next day, everything changed. No longer were direct support professionals able to work in their office. They had to work in homes. And that brought on all types of challenges for DSPs, who I have known for many long years that they are very creative and resourceful and resilient. And they rose to this occasion. They rose to the challenge. But these challenges that we've experienced since early March will have a long-term impact on their psyche. The stress, the unknown, the exposure to a horrific illness is going to weigh on them for a long time, and they're going to need our support, no question about it. The folks that we've relied on since the beginning of this pandemic are going to need our support in many different ways. What we also know is that nearly 40 million people are currently out of work due to the pandemic, and the service system, our service system, has always been dependent on economic factors. When the economy is poor, like it is right now, and like it was in 2008, we had the jobs that people came to. Inevitably, the economy improves and more jobs become available, and many of those people who came to work with us just for a job leave for better paying jobs. I think we need to understand that up front, but how can we, during this time, select the right people, identify people who really are coming for the right reasons and they're not just coming for a stopover job? How do we keep them? And how do we engage with them to make this a career? Let's not squander this horribly ugly gift. It is, in my opinion, the silver lining of which Milton wrote. So let's get at it. If you ever heard any webinars or anybody from the National Alliance for Direct Support Professionals speak, we always use this quote. It's from one of our founders, John Kennedy Jr. And when John was the president's chair of the President's Committee for People with Intellectual and Developmental Disabilities, in 1996, they wrote a report to President Clinton about the workforce crisis. And that's not what this presentation is about, but he identified something that's very important, that quality happens at that point of interaction. We are putting people with disabilities who we support into the hands of direct support professionals. And all across the country today, people with disabilities are achieving meaningful outcomes. They're achieving things that they want to achieve. They're living in their own homes, and they're working in real jobs, and they're making friends in the community. And when you deconstruct those outcomes, you will see direct support professionals doing their jobs. They are helping people live their lives with dignity. And that doesn't happen by accident. That is not by chance. Often it is not intentional. DSPs are often working with their gut and using their intuition. And I think direct support professionals always need to do that. But what we need to do is we need to create a workforce that is reflective and intentional. And that doesn't happen easily. Direct support work is challenging work. We should make no mistake. It is challenging work. It requires a high level of skill, a high level of independent decision making, good sound judgment. And it would be a mistake for us to say that just anybody who's going to come through our doors over the next 6 months, 12 months can be a direct support professional. I don't think that that is true. And I think that silver lining, we may have the opportunity to choose future direct support professionals. So to be effective, people coming to this work are going to need 3 things from us straight off the bat. They're going to need that knowledge. They're going to need to know that the training that they receive is based on sound research and evidence. It must be dynamic and contemporary and based on person-centered thoughts and approaches. That's the training. You know, and they may not, you were probably going to be in a rush to hire people and get them working with people, and that is completely understood. But we can never sacrifice good sound training for getting people to work with people. I think that sets us up for some bad things that could happen. Skills. A direct support professional, people coming to this work are going to need to learn and demonstrate their skills. Skills is intentionally using that knowledge to inform their job duties and their job practices, taking what you learned and implementing it on the job intentionally. Those are skills. That's going to take time. And the last thing, values. And we need to make sure that the people coming in to do this work set aside their own personal values and never impose those personal values onto the people that they will be supporting. They may not be shared by the people that they support, and they must always adopt the values of the profession. So the code of ethics and understanding competencies is going to be a very important early intervention to get people prepared to do this job. But even before we get there, let's take a look at the recruitment and selection process. I am a big fan of using realistic job previews. When I was working for NYSACRA in New York about 10 years ago, we created one called We Get It Done. It's about a 24-minute video of what the work really is. It doesn't pull any punches. Research has shown that these previews are highly useful to recruit and inform prospective employees for challenging and misunderstood jobs. And I think direct support work is a highly misunderstood job. As I mentioned earlier, it is not a job that just anybody can do. I think in order to get the most benefit out of a realistic job preview, you need to spend some time with each individual prospective employee that comes in and sit down with them and watch it together. You must watch it together, and you must pause it frequently and ask meaningful questions that are derived from that video. Pause it. What appealed to you most about what you saw? What did you like most about this job? And take notes, because those notes are often very informative. What concerns you most about the work? How do you feel about providing intimate personal supports to people? What did you think about the part where they discuss challenging behaviors? What would you do in those occasions? And then lastly, what other things about what you saw didn't you know about this work? This conversation, more than just providing information about the complex work of direct support professionals, be it in day supports, employment supports, residential supports, community-based supports, rather than just giving that information, I think the beauty of this is getting the information back from that prospective employee about the answers or the questions that you asked them. That is your information about this person that sets up key information for the job interview. And it's okay to say no when those red flags start waving of the responses that you get from people. It is okay to say, no, thank you, we'll get back to you. That's part of the recruitment process. I think the second piece, and given today's world that we're living in about human rights and social justice, and I think it's important to give prospective employees information about the historic nature of our work. Community-based supports and services to people with IDD has not been around a long time, not more than 45 years. Prior to that, people with disabilities did not enjoy their human and civil rights the way they do today. I think that's important to discuss. And I think whoever's doing those initial interviews, whether it be a HR generalist or somebody in your human resources office or a management person, we need to appeal to especially the younger millennial workforce, appeal to their interest in social justice. You take a look at the peaceful marches today, and you'll notice a lot of them are young people. Social justice and human rights and civil rights are very important to them. Let's have those discussions. A DSP's responsibility is to underscore the significance of life in the community. We need to make sure that DSPs understand that they are responsible for helping people access opportunities and resources that exist in the community, that are available to everyone else. We also have to make sure that DSPs can facilitate the expression and the understanding of one's rights and responsibilities, understanding the legalities of guardianship and the limitations of guardianship in your states, or the other legal representation and work in partnership with legal representatives and family members to assure that a person's preferences and interests are honored. This is complex work, but these are ways for you to separate this from just a basic caregiving job to one that is so vitally important in the life of a person with a disability, and highlighting the differences between just a caregiver and a direct support professional. These are things that human resources and recruiters need to really understand, have those conversations. The next thing is job matching. And I understand today it would be a luxury to spend the time that it would take to match a prospective direct support professional's interests and hobbies and likes with the interests and hobbies and likes of a person that we support. That is a luxury today. But I think that when we adequately match a prospective employee's interests with those of the people that they support, and using the information that we gleaned from the realistic job preview interview discussion, I think that should help us steer people to work with the right people. Whoever is doing the interviewing process must know the people that receive your support. In order for this to work, whoever is doing the interviewing process must know the people's interests and personalities and what works best for them. What style works best for those people? What are the particular needs of those people, and how can we match the strengths of that interviewee with those people? We also have to make sure that whoever's doing the interviewing knows what direct support professionals do. They must have a deep understanding of the direct support duties and responsibilities and the job descriptions. And if you're hiring people or the people who's doing the hiring don't understand what direct support does, then you've got some work to do. I always use the example, I don't know anything about biochemistry. My brother is a biochemist. I don't know anything about biochemistry. You do not want me to be recruiting for biochemists. You want my brother to do that. When it comes to direct support, I might be your guy who could help you recruit for direct support professionals because I know that job. Bad job matching leads to early turnover. And that has been proven time and time again. Putting people into jobs that do not meet their skill sets and their interests just leads to turnover. And lastly, I would say that good matching, when you match somebody with somebody who they just click, they may leave their job one day. And if they do, they may have an ongoing relationship. They may become friends. And I think that that is the only good turnover that exists. Some people might say, well, there's some people that we work with that should turn over, and that could very well be true. But I would also argue that that may be bad hiring and hiring the wrong person. So again, hiring people, I worked with an organization in Maryland, and I worked with a broad stakeholder group of that organization. And on a break, I was sitting there and I was talking to somebody who received supports from that organization. And we were just making some small talk. And I asked what he likes to do for fun. And he said that he likes to ride his bike. He's a bicyclist. And oddly enough, so am I. And that's my hobby. So we were talking, and the longer the conversation went on, the more I realized how much he truly loved cycling. And afterwards, I went to the executive director and I said, if I ever lived in your community, I want to work with him because we could ride our bikes together. And if I ever left, chances are we still might ride our bikes together after I left your employment. That is rich. That is good job matching. And I realize that that's a luxury, but I think we should try it. Another recruitment strategy that you might be able to use, and this is not easy, it's easier said than done, is including the people that you support in the interview and hiring process. And again, this is not a new idea, but when it's done right, it's been proven to be very, very effective. It's not easy to do, and it could be done improperly very easily with the best of intentions. First of all, the person that receives supports that you bring in should be a full member of your hiring team. It should be a job for them. It shouldn't just be a token opportunity to be part of the hiring process. You know, to learn from these people. The people who receive supports know the supports better than anybody. The person should have an understanding of the bigger picture. It's not just about me and my needs, it's the needs of all of the people that we support here at this organization. And that person should have a basic understanding of the legalities of the hiring process. And there's just some questions that you can't ask. And that's part of the process. I think where this works best is it's best used in a group interview process. Again, that may be a luxury during these times, but to have a group interview process where you can have 3 or 4 people who are in the hiring interview to share questions and to share feedback, and then to gather together to talk about the pros and cons of this particular potential employee. Lastly, it's simply a great paid employment opportunity for people with disabilities, and I think that should be strongly considered. Again, it's not going to cost you much, but I think this is a good process. I'm going to move on to onboarding and professional development, and you'll notice that I call it professional development and not training. There's a big difference, and I think that we need to, in terms of direct support practice, we need to start referring to it as professional development. I think we need to really consider the types of trainings that we provide to direct support professionals. I think they need to be dynamic, and I think they need to stimulate adult learners to engage and provoke and pursue critical discussion. The last thing that I would like to see is direct support professionals. I have three 3 millennial children, and they do not learn the same way that I learned in school. They need to be engaged. They need to have these critical discussions. They like to learn in group settings. And I think that we can do better. I also think that in using online learning platforms is good, but I also think that they need to be blended with a classroom model or a virtual model during COVID-19 that engages them more. But beyond that, whoever your organization uses to lead these trainings, that person needs to be highly skilled. That person is a key figure in your organization. They are the people that gives the new hire the first impression of an organization's culture. They are usually, and by the way, a lot of employees 3 or 4 months down the road, when they're struggling or if they have some questions and they're not really comfortable to go to their supervisor, they're often going to seek out that trainer because they trust them. They were the welcome to this organization on day one. And that person is key to your organization. These trainers are also able to give management objective information on these new employees' interpersonal skills and their abilities to develop professional relationships, their learning styles, their communication styles. And there needs to be good communication between the program people and the training department or whoever does the training. Furthermore, these trainers need to have some authority. I have never done orientation training myself, but some of my colleagues at NADSP have, and they should have the authority to remove a new employee from the training room at any time and make recommendations for dismissal from employment. It's better that you do it before they start working with people, and we need to trust their skills as trainers and as educators to identify people who are not going to work out. It's better you do it on day 1 or day 3 rather than a month into the job. Lastly, I think adult learning models, group activities, as I mentioned, role play scenarios, facilitated group discussions, they are best practices in teaching young adults and any adult, to be honest. I would limit the read and signs. I would limit, if not extinguish, reading policy manuals. You want to ruin a first day of employment, give them a policy and procedure manual and ask them to read it. It doesn't work. Lastly, I think more Mr. Keating and less Ferris Bueller's teacher. Engage, have fun, discuss. For those of you who may not know who Mr. Keating was, that was Robin Williams' character in Dead Poets Society. Of course, he was inspirational. He was passionate. He cared about his students. He challenged his students to be better. That's what we should be doing with our direct support professionals, rather than, if you've seen the movie Ferris Bueller's Day Off, you'll know Bueller, anyone? Onboarding and professional development. So current state requirements, and I realize that a lot of training requirements during the pandemic have been lessened through special waivers, but I would never sacrifice onboarding and training and development orientation programs for DSPs, whether we have to do them remotely or not. But the state requirement training is not robust like competency-based training, values-based training, foundational professional development for DSPs training. That's the rich stuff. Most states, every state training requirements are different. Most require trainings that are related to health and safety, like first aid and CPR and bloodborne pathogens and corporate compliance, and of course HIPAA, and all of those are very important. You have to do them, but I don't know if they are as necessary and fundamental as some of the really rich competency-based trainings and values-based trainings that they're going to need to be successful. No state has required trainings that cover the NADSP competency areas or the code of ethics. And of the states that do require any type of certification, they're really not based on competencies. So the bar is set pretty low. And again, I think if there's a silver lining, can we raise that bar? Can we hold our new employees to a higher standard and get them prepared to do this work? There's other things in terms of onboarding, and this is really kind of a retention tool, if anything else. I think we need to give DSPs, once we start to have access to professional conferences, and of course, it's subject to the COVID-19 restrictions in your state. We're not getting together anytime soon. Hopefully someday that will pass soon. But when we're able to travel and get together in groups, professional conferences, DSP conferences are really, really important. Very few direct support professionals are given the opportunity to attend professional conferences, especially those who require an overnight. And that's really where the fun happens, of course. We should make sure that professional conferences give DSPs the opportunity to speak with other direct support professionals, to build their community of practice, to share best practices, and to have fun. There is nothing better than spending a couple of days with direct support professionals from different areas of the state or the country, and listening to them speak and being part of their conversations. It is powerful. It demonstrates that DSPs, when you send DSPs to professional conferences, that they're valued and that they're respected and they're included in your organization, and the return on your investment is substantial. They're going to come back and they are going to buy in to your organization tenfold. Lastly, and this is just an aside, because I remember when I was a direct support professional, I was sent to a conference and I was asked to write up a report on what I learned. I think that's disrespectful. Unless we're doing it for the executive director of the organization and everybody else who goes to the conference, we should not be asking DSPs to write a report about what they learned. You know they learned, and you know that they were engaged, and I think that's good enough. And obviously, this is in the future. More onboarding ideas. I think we should really take a look at some of the tools that exist that NADSP has provided to the field. There's a lot of great training curriculum out there, online and classroom-based, that we have reviewed, rigorously reviewed, and have provided accreditation to. They're on our website. They are competency-based, they are research-based, and they are really the foundation of what a DSP is going to be asked to do. I also think that we should incorporate the code of ethics into daily practice. Daily practice, not a read and sign and not a one-time training, but encourage DSPs to live the code of ethics every day and reflect on ethical dilemmas that are sure to happen in the course of your work almost daily. I think we should take a look at using the competency areas and the code of ethics as a basis for our job descriptions and our performance reviews. And I think if you really want to review a DSP's skill level, are the people that they supporting achieving their outcomes? And if they are, your DSPs are doing their job. I know it's deeper than that. I know it's more than that, but we have and we can provide you with job performance and job descriptions based on our competencies and ethics. And lastly, and we can go on about this, and Lord knows I might, we need to help DSPs understand the significance of helping people make their own decisions, big decisions and small decisions, daily decisions, clothing decisions, food decisions. It's a process. And if you look to the left, there's a 5-step process that we use in teaching DSPs on the value of helping people make decisions. And humans learn from making bad decisions. It's human nature. That's how we learn. And in our field, we often prevent people with disabilities from making a bad decision because we know better. And that's not good enough. See, this is the complexity of the work that these new people may need. Here's a list of our 15 competency areas. I'm not going to spend any time on this, but I can tell you a couple things. They are nationally validated. They are universal, which means your DSPs are doing them already, no matter where you're located. And they are portable. So if a DSP is demonstrating their assessment and discovery skills, which they do very, very well, they're probably doing it in a more intuitive nature where we get to know people and I know this person and this is what this person does and this is what this person does when he's angry. That's a skill. And DSPs, as some of our staff at NADSP talk, DSPs don't give them enough credit for their skills until they start seeing them do these skills intentionally. They understand the process of implementing these skills. The code of ethics is certainly different. The skills are behaviors that can be observed and measured. I think the code of ethics and the values of the field are certainly more difficult to measure, but they're internalized. And again, there's 9 of these, and we should be giving a overview and a training to any DSP before they begin to work with people on the code of ethics and your ethical responsibilities. Before you meet a person that you're hired to support, you must, without any question in my mind, understand the code of ethics. It'll help you. It's your roadmap. You're going to be lost. Here it is. I've got a few ideas on retention, and again, this is down the road. This is trying to keep those people in this line of work. The people who come to this work who are just, again, something about this work grabs you and you don't want to leave it. We need to implement career ladders and career lattices that gives financial incentives to remain in this work. And a lot of this is policy work. A lot of this is advocacy. And post COVID-19, we've got a lot of advocacy work to do. And one of them is to implement a career ladder model that incentivizes people to stay in this job. Today, direct support is a dead-end job. Now, you're not going to tell these people who are coming to your work that this is a dead-end job. You will never say that. But between you and me, you know the truth. The only way DSPs make more money is by working more than one job, or working a lot of overtime, or get promoted. That's the fact. You're not going to tell people that, but you and I both know it. We often promote really good DSPs out of their jobs that they excel in and put them into a supervisory job, which requires a completely different skill set that they may not excel in. They may not be a good leader or a good manager of others. But that's the only way we can keep them. And I think that's a mistake in our field. And I'll tell you why. Many DSPs that we work with and talk with over the last 10 years tell us that poor supervision is often a key factor in turnover. Are we developing and preparing strong frontline supervisors from within the direct support ranks? And are we able to fill this important role with people who are prepared to do that job? The frontline supervisor job is perhaps the most difficult job in our field. And we have to do more to prepare them for that complex job. Career ladders, we've got them. We've created a digital credentialing program called the eBadge Academy. Because the expectations on direct support professionals are overwhelming, involving a lot of different job responsibilities that requires a wide range of skill sets. Beyond the complexity of this work itself, it often feels that they are not acknowledged for their professional contributions, and we need to give them that respect. Direct support workers through a credentialing program are able to demonstrate their skills and their knowledge and their education. They can build up these professional badge portfolios, and they can share it with their peers and their colleagues. It'll help them get jobs in the future. It displays their talents on resumes. We know where they excel. And this is really important. It's not unlike any other career. Again, advocacy work never ends. We've got a lot of advocacy work to do. Lastly, because of this blog that I wrote and the work that we're doing to help organizations onboard these new direct support professionals that we're going to be gifted with, we realize the challenges of onboarding new DSPs during the pandemic. We understand it's not going to be easy. So we're putting a webinar-based curriculum to help organizations prepare unfamiliar direct support professionals with necessary fundamental information about the foundation of direct support practice. This webinar training curriculum is not going to include HIPAA and bloodborne pathogens and corporate compliance and CPR and first aid. You're good at that. You're required to do that. But what we are going to offer you is a really cool web-based, webinar-based series on an introduction to direct support. This is what you can expect as a direct support professional. We're going to pull from those realistic job previews, and we're going to engage with your new hires about what you can expect as a direct support professional. We're also going to highlight the competency areas. These are the skills that you're going to be learning. These are the skills that you're going to be required. We do as a direct support professional. We're going to have an area on the code of ethics, on understanding the values of the work and how to incorporate that every day. We're going to provide a history of supports and services for people with IDD. This is where we've come from, and this is how people with disabilities have been treated in our history. It's going to be engaging, it's going to be fun, and we hope that this is going to be helpful and take some of the burden off of you to train your DSPs to get them ready to support people with disabilities and start having those really good, sound relationships. So stay tuned for more information. We look forward to working with you. We'll be putting out a lot more information once this curriculum becomes available towards the end of June. And until then, I hope this was helpful, and I hope that I gave you some information that you might find useful. If not, don't use it. And I'm sure that we'll talk again. So thank you for your time, and keep in touch. Stay healthy, stay safe. Goodbye.